Hello, this is Pam. Today we are talking about building our game plan to treat the chronic infections that are causing the terrible disease symptoms that we're living with. They're causing the disease. This is step number 6 and 7 in the Live Disease Free plan. Over the past few weeks, we have been discussing the first steps, the steps where we are getting ready to treat. And we're going through preparing through diet, following the Live Disease Free diet. We are supporting the body. We are making sure that we minimize the toxin load around us. And obviously, the biggest toxin load is coming from the infections inside our body, especially in our digestive tract. And then we are working on the mindset, having the mindset of a wellness champion. We're building a healthy lifestyle. So we've done a lot of work already in the Live Disease Free plan to make sure that we're set for success. Because if we think that we can just pop a pill to recover from these deep level infestations of parasites, it doesn't work that way. And we have to do things to support our body. We have to do things to support the healing process. And then we are at the point where we're ready to treat. So this is step number 6 and 7. We'll be talking about step number 7 next week, but this week it's step number 6. So this is part 1 of building our game plan to treat these chronic infections. Because the truth of the matter is there is no diet or exercise that will get these parasites out of our body. We have to physically treat them. We definitely support our body. We start feeling better. We go through those other steps, really important. But in order to really recover, we have to treat them. Multiple sclerosis and all chronic diseases are stemming from infections in the body. And these are not picked up easily by our doctors, by our standard of care. They don't have the tests. They haven't been trained. They don't believe that we have parasites in developed countries. They think that parasites are something that we would pick up if we're traveling in an underdeveloped country. Nothing farther could be from the truth. So let's talk about how do we start building this game plan. If you enjoy this, if you love to learn about what the steps you need to take to recover, then make sure to like and share this video and subscribe to our YouTube channel, Live Disease Free. I'm going to be talking about a few videos that I have there that'll give you some background if you're wanting to follow along with the plan. So if you missed steps 1 through 5, you'll find those on our YouTube channel, Live Disease Free. Make sure to watch them later because those are really the steps that we take so that we can set ourselves up for success. And this is where people are having miraculous recoveries. And it's just really supporting our body so that it can do what it is designed to do. And if you'd like to listen to some of their successes, you can also go to our Live Disease Free channel on YouTube and listen to the Wellness Champion successes. So they've implemented these steps. So step number 6 today, part 1 of building healthy life, not building healthy lifestyle, building our game plan to treat. So how do we do this? Number 1, we look at our health history, the health history of our parents, and we're going to talk about each one of these steps. Number 2, we consider our diagnosis, what we were diagnosed with. Some of us don't have a diagnosis. Some of us are catching this early, and that's fine. But the third step is what symptoms are we dealing with? And we'll talk more about that. And then what really is helpful is that a lot of our students, depending on the country that they live in, they will have energy testing done. And we'll talk about what that is also. Let's start with the first step. And that's really looking at our health history and the health history of our parents. So I shared on my masterclass training, and if you joined in on that, I just did my last one for the year, the live masterclass training. We had almost 1,000 people join and register for that. And on that training, towards as we went through, probably partway through the training, I was sharing that Dr. Klinghardt, who's one of the hero doctors that I've studied under, he has a really profound statement. And he shares that the microbes that we inherit from our birth or at birth from our parents impacts our health far more than the genes that we inherit from our parents. So the microbes that we inherit from our parents at birth far exceeds the impact on our health that the genes that we would get from our parents. And so what does he mean by that? So when we pass through the birth canal, and that's assuming that we were born as a natural birth, a C-section is a different story. We'll talk about that in a minute. But when you're born through the birth canal, the microbes that live in the birth canal of your mother are the microbes that came from her digestive tract, GI tract, and your father's digestive tract. And that's what's growing, that's what's living in the birth canal. So when we pass through the birth canal, then we are picking up all kinds of microbes. So that's why we look at the health of our parents. We look to see, have they had a lot of disease symptoms? Have they been on a lot of antibiotics, sometimes years ago when they were young? Do they have different types of chronic diseases? Do they have heart disease? Do they have some type of autoimmune disease? Have they had cancer? Because all of those things will indicate that they are really out of balance. They have dysbiosis or severe dysbiosis, especially if they have disease labels. And so that would mean that in the birth canal, we probably picked up a few different microbes that were not very healthy. And that can really impact our birth. And of course, things like a traumatic birth can really impact our health too at birth, etc. So that's the first thing we do, is we look at the health of our parents, the health history of our parents. Then we look at our health history. For me and for some students, it happened right at birth, whether you had a traumatic birth. If you were a C-section baby, then you would have picked up microbes that were in the room, in the birthing room, from the doctors and from whatever's in the environment. And so you would not have had the beautiful inoculation of health promoting microbes that we're supposed to get if we were not having a lot of antibiotics. So that's why it's really important to look at the health history of our parents and then to start looking at our health history. So then we ask ourselves questions like, even before the age of 10, did we have things like ear infections, tonsillitis, bronchitis, strep throat, bladder issues? Were we on antibiotics early on in our life? For most of my students, they were on antibiotics before the age of 10. Then we look at, did we have surgeries? Did we have our appendix removed, or tonsils or adenoids removed? Did we have different surgeries? Maybe we were in sports and we got injured. Maybe we were in an accident. All these things, many of them would warrant the use of antibiotics. Then when we're as a teenager, were we on antibiotics for acne? I was on antibiotics for acne. I was on tetracycline for a few months. I was the only one out of 6 kids that was on tetracycline for a few months. And I was the only child in our family that ended up with a serious chronic disease. And in my book, Become a Wellness Champion, I've cited a study where they did a retrospective study. They looked back on thousands of people, and they found a really significant increase in people that had used tetracycline and ended up with chronic disease later on in life. So we know that these broad spectrum antibiotics, they can really disrupt our ecosystem. So this is part of the assessment, because a lot of people are like, well, how do I know? Like, how would I know if I have these infections? Like, what kind? So this is really helping us to understand how we got to this place, why we ended up sick, how we can have this parasitic infestation. And then, so we're looking at our symptoms and especially our health history as far as when we were on antibiotics. And then we can also look at what our life was like. Have we had a lot of cravings? Have we had a strong sweet tooth? Have we had cravings for alcohol, sugar, caffeine, things like that? And where we're binge eating, where we're just addicted to sugar. So those kind of things would also indicate that we're out of balance, because yes, sugar is addictive for sure. But when we have a real infestation of these microbes, they make us crave sugar like a drug addiction. And a lot of people can relate to that. So did we use a lot of antibiotics? And then we look at like our history, like were we eating healthy? Were we eating a lot of sugars and processed carbs? Were we, irresponsible as a teenager, drinking too much and just partying and smoking and whatever we were doing? Some people yes, some people no, but all of those factors would have definitely impacted our microbes, especially our diet. That is probably the number one thing. So all of that really helps us to look at our health history and our parents' health history and the circumstances in our life that brought us to this place. Then the next thing that we do is we look at our diagnosis. So for those of us that have had a diagnosis of some type of chronic disease, multiple sclerosis or other, or sometimes our students have MS and diabetes, or MS and they've had cancer, or they may have 3 to 5 diseases, not just multiple sclerosis. And we see this over time, especially when we're using the immunosuppressive MS drugs, because they're suppressing our soldiers. We have different other types of microbes that kind of get a hold on us. They move into different parts of the body. They cause different symptoms. And then we have a different disease label. So very important to consider our diagnosis. So let's say if we have a diagnosis of multiple sclerosis, then we know that there are specific certain symptoms that are very characteristic. And there are also overlapping symptoms between different neurological diseases. So we're seeing that people with Parkinson's or multiple sclerosis or PLS or ALS, they have different infections, but they also have similar infections. So very often they're testing well for very similar treatments. So that's very important to know too. So we're looking at their diagnosis, and really importantly, we're looking at their symptoms. Because we do not have good stool tests, the symptoms and the health history and the diagnosis are really, really helpful, really important to get us to the place where we are building a game plan that is for the types of infections we're dealing with. There are very specific symptoms for parasites like worms and protists. Protists are single-celled parasites. There are very specific symptoms for fungi, for different types of molds and yeasts. There are very specific symptoms for the Lyme infections, the Lyme disease. And so this is where, when we go through an assessment form, and that's what we have in the Live Disease-Free Plan, we have a 14-page assessment form where people can check off current and past symptoms so that they can say, oh my gosh, I have a lot of symptoms of worms. I never even thought about that. Or, gee, I never considered Lyme disease. I never considered Borrelia, Babesia, etc. Or fungus. That's usually one that a lot of us have had. We've heard about Candida, but sometimes we may not consider molds. We might have been living in a moldy environment. We may have mold issues inside our body also. So this really helps us to become more aware of the different types of infections that we're dealing with. Again, all of this is so important. I want to paint a picture for you so that you understand that don't hold your breath for hoping that our doctors are going to have tests right away and be able to figure out what we have, because there are thousands of worms. There are thousands of different types of fungi, or hundreds, I should say, of fungi for sure. There could be more, but we know there's thousands of different types of worms and parasites in that area. There are many, many bacteria, like hundreds, if not thousands of different bacteria that can cause disease in humans. And so because we have ignored this, we don't have good tests. Our healthcare professionals are not skilled at identifying and recognizing. They haven't been trained. They don't have good tests. So, for us to really figure out exactly which infections we have is going to take years, if in the research medical field. But we don't have to wait for years, because there are very specific treatments that will cover worms and certain types of worms. And then a couple of others will cover different types of worms. So we can overlap because we see similarities when we have chronic disease as to which types of parasites we're dealing with. Again, so let's talk about, we talked about the symptoms. So we go through the assessment form, and it's really eye-opening for the students to kind of see what different types of groups of parasites they're dealing with. So with respect to the worms, we see a lot of roundworms, like really big roundworms. They can be 2 to 3 feet long. We have seen many that are at least 2 feet long. Tapeworms are definitely part of chronic disease. Dr. Alan MacDonald found them in the central nervous system, the larvae, the immature forms of the tapeworm, but also developing tapeworms in the central nervous system of MS patients that had died. And he was examining their spinal fluid and their brains. So we know tapeworms are an issue for a lot of people, not all. And this is a problem. It's not like everyone with MS has a tapeworm, you treat it and you're over and you're better. I wish it was that easy. It's not. So roundworms, and we talked about the big ones, but Dr. Alan McDonald also found very small filarial worms that you wouldn't necessarily see with your eyes in the central nervous system of every single MS patient he tested. But very often, those little tiny roundworms are treated with similar parasite drugs that the big roundworms are treated with. So that's helpful. But tapeworms would be very often needing a different parasite medication. And then there are flukes. So flukes are flatworms. There are intestinal flukes, and I am sure that I've passed some of those. I grew up on a farm, had stomach issues all my life. And there's also flukes that are smaller, and they're called liver flukes, and they will go into the liver. And so there are different treatments for flukes and for tapeworms and for roundworms, but those are the basic groups of the worms. And we have hundreds of pictures of worms. And if you would like to kind of learn more, maybe this is the first time you found me, you'd like to learn more about the different types of videos that I have to see the connection between MS and fungi, Lyme disease, and parasites. I have a bunch of videos on YouTube you can look at. So I have one called Symptoms of Parasites. So this is on YouTube, Live Disease Free. And you can go there later and you can look at, I do have a playlist on infections, but I don't know if all of these are under there. I think they are, but or you can just go to Live Disease Free and you can search for symptoms of parasites to see if you feel that you have parasites. There's also symptoms of Lyme disease. That's another video. The link between Lyme disease and multiple sclerosis. Another video I have is symptoms of candida overgrowth. Symptoms of candida overgrowth. Another one, MS and fungus. So there are a bunch of different videos that I have. Then if you'd like to see research that is linking MS to these various infections, you can go to livediseasefree.com, our website. In the main menu, there's a research tab, and you can click on that, and you can look to see many different studies where people that have multiple sclerosis, and this is not just MS, but because I tracked a lot of people with MS, then I've just put a lot of research there for that. So, but you can find this research by typing in your disease, the disease you are diagnosed with, and then infection, fungus, Lyme, parasites, under a search engine like MedPro. No, it is called PubMed. Sorry, that's something else. That's a nebulizer. So PubMed is a database where you can go. You can just do a search for PubMed, and then you can just type in whatever disease or condition you're dealing with, an infection, chronic infection, fungus, Lyme disease, Borrelia, etc., and you'll see a bunch of research. But for MS, if you go to livediseasefree.com, look under research, and you'll see a lot of studies that are linking MS with different infections. So hopefully, through all the work that I've done, I've helped you to see that yes, MS is an infectious disease. Yes, in order to recover, we have to treat, and that's what we're talking about today. But in a general sense, to kind of give you an idea, like if you've had symptoms of, like for fungus, I'll just give a couple here, like dandruff, jock itch, yeast infections for women, candida, a lot of sinus issues for sure, rashes, athlete's foot, fingernail, toenail fungus. So those would be some symptoms of fungal overgrowth, being allergic to antibiotics also. And then for worms, a lot of times there's gastrointestinal issues where there's constipation. Fungus can cause constipation also, but worms definitely too. And back pain and stomach pain, mood issues, and then all the symptoms of multiple sclerosis. So, and it's just not for MS, because a lot of other neurological diseases, they also have things like balance issues. They can have bladder issues. They can have muscle cramping, twitching, muscle twitching and cramping. But then there's an overlap with Lyme disease too. But so it's when you look at all the symptoms and you can see patterns of, okay, I have a lot of these symptoms and I have a couple of those. So it's probably this that's more abundant or more of a problem. And then for things like protists, like Babesia is one of the single cell parasites that's really involved a lot with MS. And that's where we can have day sweats and night sweats and headaches and tinnitus and little red blood blisters, especially on our torso, and dry cough. And it just goes on and on. Flickering vision, all kinds of different things that are specific. And then Borrelia has its own set of symptoms. So it's really helpful, right, when we're building the game plan. And it's really helped us to get to this place where you have a lot of people that have recovered from MS and that are on the journey to recovery right now. So that kind of gives you an idea of, but our assessment is like a 14-page assessment. So it really gets deep into this. And the last one I wanted to talk about is energy testing. And it really depends on the country that you live in. But energy testing is considering that all living things have an energy field around us. And when we are really in balance and we're strong and we're healthy, we have a strong energy field. But there are things that can compromise our energy field. And it could be infections, it could be toxins, etc. And when you bring a remedy into the energy field, it makes you more balanced or stronger. So this is biophysics. It's not anything weird. It's just biophysics. And so the nice thing is that for practitioners that are skilled, they understand that they're able to test to see which treatments will be the most helpful to restore balance. We don't have good stool tests, unfortunately. We don't have good DNA tests at this time. We're working on it, or the labs are working on it. But again, even with the DNA test, there are thousands of worms. And when I've spoken to some of the really good labs, they're like, we're taking a minuscule specimen of blood, for example. And if the DNA is not in that tiny, tiny little sample, it's not going to pick it up. And then also, another thing to consider is that let's say if you do, and we've done this before, some of us have done a DNA test for Borrelia, Babesia, the Lyme infections. And so if it shows that you have genetic material in your blood, for example, for the Lyme infections, and it shows positive, so does that mean that the Borrelia is causing all your MS symptoms, or does that just mean you have some Borrelia in you, or Babesia, etc.? So this is the problem with DNA tests. Just because something shows that it shows some genetic material in your body, it doesn't mean that that is the microorganism that's causing a lot of your grief. That's a problem. And number one, they don't sequence for the thousands of different worms that are out there and the thousands of different bacteria. They only have sequenced, they found the genetic code only for a small number of microbes. So we can spend $750 to $1,000 and find, number one, that maybe there's some Borrelia and Babesia. They probably will miss the worms. And is that really what's causing our problems? So that's the dilemma that we're in right now with testing. And with stool tests, good luck with that. You can do a comprehensive stool analysis. And I have yet to have seen a really helpful test result for that. I would say save your money. That's my humble opinion. Save your money, use it towards treatments, etc. But with respect to energy testing, so we're not too worried about which species of worm you have or etc. We're looking to see which treatment works best for you. So then if we see that, you test well for 3 different worm treatments, dewormers, that really treat roundworms, then you probably have roundworms. Or if you test really well for 2 or 3 different treatments, parasite drugs that would treat tapeworms, then you might have a tapeworm. And there is overlap. And honestly, at this point, we're like, we don't care. We just want to use something that works and treat these parasites, and we see them coming out. So today we're going to talk about getting ready to that place, and then what the students are doing before they get the parasite drugs. And then next week, I'm going to talk more about the parasite drugs. But I think I haven't figured this out yet, but I would like to go on a different platform because it's a little too spicy for Facebook and YouTube talking about the parasite drugs. Of course, I will talk very responsibly because I don't want anyone taking anything and hurting themselves. But we're going to talk at that time next week more about like the different types of parasite drugs and what they're helpful for, and just important things that we've learned about them, and kind of like what are some protocols that these doctors are using, etc. But again, every person is different. With our students, we've helped several hundred using the parasite drugs, and it's not a cookie cutter treatment plan for everyone. I wish it was. It really depends on what parasites were you exposed to, right? And it's not necessarily that you traveled. For me, I was on a farm. We had pigs, horses, we had cats, dogs, we had bunnies, we had every animal, chickens, we had turkeys. I was in the dirt a lot. We were playing outside. So I was exposed to those kind of parasites. And maybe you lived in a different country and you were exposed to a little bit different parasites. Probably similar groups of parasites, but could be different. So that is our problem. So when our students have gone through the first 5 steps and they've really supported their body and they're feeling a lot better and they're starting to build the game plan, this is what we're talking about. So they look at all these things. They look at their diagnosis, their health history, they look at their symptoms. They also may want to be energy tested, and we're talking about that. So this is where there is somebody like let's say a chiropractor that does applied kinesiology. It could be a naturopathic physician that does some type of either muscle testing, or maybe they use a machine. So there's a EAV machine, there's a Vega machine. Then some of the naturopaths use ART, autonomic response testing. And then some doctors and other doctors, I would say that I only know doctors that have been using AMA, which is acupuncture meridian assessment. That's another machine. And so this is literally working on the biophysics of our body. And so that can be another tool, because then it's like, okay, well, we know you have these symptoms and you have this diagnosis. And we've seen that quite often for people with this certain condition. These seem to test really well. Oh, that's consistent with what you got from your energy testing. Great. And then our students will then get a prescription, and then they will start treating. And we'll talk about just the treatment cycles today. So while they are in the process of, figuring out which of the parasite treatments are testing well for them, they will start with herbs. All right. And this is something that antimicrobial herbs, this is something that we've used for years, but we found that they're just not strong enough on their own. We have to use layering of therapies. And that has to do with when you're dealing with, let's say, over a 1-foot worm and you're taking herbs, very often that's not going to be strong enough, effective enough for treating a 1 to 2-foot worm in your intestines. The herbs are also not strong enough with the doses we're using to treat the worms in your blood or your central nervous system or your organs really well. And so that is why we're using a combination of herbs and parasite drugs and an oxidizing agent. So while the students are, they're finding a practitioner to do the energy testing and someone to do the writing of prescriptions, they're starting with herbs at that time. It's still helpful. It's still going to knock back the smaller critters. A big part is in the gut. So the smaller bad disease-causing bacteria and fungi and Lyme, etc., in the gut, definitely going to be helpful. And students tolerate the herbs a lot better because they've done all the prep work. That's so important. So they've done all the prep work. They're starting to use the herbs while they're getting their treatment plan in place, the full treatment plan. They're also using an oxidizing agent. There are various oxidizing agents that are available, like oxygen type. We can take some of them, we can do them orally, we can do enemas, and that really helps to start treating the parasites intestinally and in our blood, etc., especially the smaller ones. So they're using those things while they are getting the parasite drugs lined up. And by that time, they know how to find a practitioner because they know what they're looking for. If you start looking for a practitioner too early, then you go into their office and they're like, well, this is how we do things. We want to do allergy tests. We're going to test you for food sensitivities. We're going to desensitize you. We want to do hormone tests. We want to look at your adrenals. We want to give you certain hormones. We want to do heavy metal testing. We want to do heavy metal detox. We want to do this. We want to do that. And before you know it, you have spent thousands of dollars, and you haven't even gotten to the treatment part yet. And so that's why our students, they wait with looking for a practitioner until they're ready to treat. And then at that point, they literally know what to look for. They know how to ask the questions, even by looking at their website and just sending in a little script we have. Like, hey, I'm interested in treating parasites. Would you, do you do any type of energy testing? Would you energy test the treatments? Or if it's a doctor, would you be interested in supporting me through treating parasites? We're following doctors' protocols, and there's all the rationale. Everything is for the doctors, so they know. And so that's my job in the academy, is to help the students to find the practitioners that they need so that they're using the treatments safely and effectively. And so that is why they're starting with the herbs, and they are still noticing symptom improvements, because there are certain herbs that are really helpful. And those would be, like, you've probably heard of them before, wormwood, and that is really helpful. Tinctures are usually more helpful than the capsules, but we don't do, and we'll talk about that with drugs. Like when you're treating, there's certain things we have to be careful. We never mix alcohol with the parasite drugs or the fungal drugs, and understanding how they're, some are metabolized by the liver. They're safe when they're used properly, but we just have to use them safely. And because we're not treating parasites in the developed countries, we really have to learn this skill ourselves, because we want to protect ourselves, keep ourselves safe. We want it to be effective. And we can't rely on our doctors and even our pharmacists. They'll look things up for us. There are a few pharmacies that understand this, but most of them, it's pretty new to them. It's a lost skill. That I'd say it that way. So as they are using it usually takes 3 to 6 weeks to get to the place of treatment. And when they're at the place of treatment, they will do multiple cycles. Just one sec. All right. I'm going to go to your questions. The treatment cycles, they are about a month long, and we will have about 14 days of treating worms and protists, and then we will have about 10 days of treating fungus, and then we will have about a week break. Okay, I'm going to go to your questions. All right. Hi, Brian. Oxford, New Zealand. Awesome. Greetings, Maurice. Sorry, I have a little tickle in my throat. I've been talking a lot today. So, hi, Alexander. Maurice, you live alone. And you can't really do what needs to be done. I honestly think that you can. This is the simplest and the most cost-effective way to treat these infections. So we have some students that are in extended care facilities. We have people that live alone, but it's baby steps. It's taking one step at a time. So we don't tackle this whole plan at once. It usually, again, takes, for some people that are really disabled and they don't have a lot of support, they take longer. Some people, it might take them 3 months to get to the treatment part, where other people, if they have a lot of support, they're not as disabled, it might take them 3 to 6 weeks to get to the treatment part. It really doesn't matter. We don't judge ourselves against other people. We focus on, where we're at, and are we doing the best that we can with our resources, with our support, with the energy we have. And every step that we move in the forward direction is a step in the right direction. So even with the diet to start off with, Maurice, it can make a really big difference for you. It can make that you are starting to have incredible symptom improvements. Make sure to watch the videos, the Live Disease Free on YouTube channel. There's a playlist on the diet. That's the first step. Start to change your diet, and then start to learn about the infections and start to clean up your environment, support the body. There's a lot of things that you can do. I have a lot of free content on the videos that will help you tremendously to get a head start. Hi, Alexander. Hi, Galen. USA, awesome. I love the USA. So you've had MS for 14 years, going on 15 years, Maurice, and you're tired of it. And the only way to recover is to take a different path. It is to treat the infections that are causing your symptoms. Otherwise, we continue to become more and more disabled, and we have a very difficult life. It's really hard. MS is a brutal disease. My heart goes out to you, but you're the only one who can take a different path. Hi, Joanne. Does so primary progressive multiple sclerosis hurt the tailbone? The thing is that with multiple sclerosis, it's caused by infections, and it just depends where the infections are. So yes, it can definitely hurt. Your tailbone can hurt. It depends which nerves are being impacted. And then also sometimes when we're disabled, then we might not walk properly, which can really impact different muscles and different nerves. It can throw our back out. So there's many different mechanisms of why we have pain. It could be we're out of alignment. It could be that we're favoring certain muscles because we're disabled. But very often, these parasites, they move into our spinal cord. That they're a big part of back pain. I've done a video a long time ago about they are finding little worms even in bone marrow. So this is what they're not looking for, because our healthcare system is basically settled on, let's just suppress the immune system. We can have patients on these immunosuppressive drugs forever. We can have profit forever, and we don't need to treat the cause. And that's not how the doctors talk. They're doing the best they can with what they've learned. But our healthcare system at the very top, they made a decision a long time ago not to treat the cause. And we can end up with all kinds of pain, including tailbone pain from these infections. Hi, Galen. Your neurologist just retired, so you guess that you have to get another one. So your neurologist, it's fine that if you want them to monitor you, it's fine, but all they can offer you is the MS drugs. And if you feel that the MS drugs are your answer, then go. That's where you go. They're the experts on the MS drugs. But if you are sick and tired of living with your disease, and if you want to know, is there a cause, if this is brand new, make sure to watch my videos and start to learn about this. Watch my masterclass training that I just did. We had an amazing group of people listening in and a lot of good questions from all over the world, even Brazil. We have students from all over, Kuwait, Indonesia, lots from, of course, the UK and United States and Canada and New Zealand and Australia. But we're starting to reach other countries, many other countries, which is really awesome. And so there is a movement, people that are just fed up with not knowing, like that MS is this or other disease. It's just a mystery. We have to live with it. We have to suffer. We have to become disabled. We have to take these very strong drugs that cause a lot of adverse effects, and we don't get to live our life. And that is what we choose if we follow our standard of care. If we choose to take a different path like I did and like the wellness champions do, where we are treating the cause, that's what's very different about the Live Disease-Free plan or system. It is that we're treating infections. So it's not just a diet program. It's not just an exercise program, but it is treating the infections that are making us feel sick and causing all our symptoms. That is the strength of this. That's what makes us unique. That is why people are recovering, that they don't need their pain medication, they don't need MS drugs, etc. So Galen, you're having sauerkraut before you go to bed. I personally wouldn't have sauerkraut just before bed. I would have it earlier in the day. And if it's raw sauerkraut, that can be health promoting, but I would not have it just before bed. I would not eat just at least 2 hours before bed. So eat a little bit more with your supper, but for at least a couple of hours, don't eat before you go to bed, because our digestion slows down when we're sleeping, and we are infested with different types of disease-causing microbes in our digestive tract. And so when we're eating just before bed, that food is not going to be digested as well. It is going to be food for the infections in our gut, and they're going to benefit. And then we feel worse in the morning. We can feel hungover, we can feel foggy head, tired, like we were hit by a truck, etc. And so that's why it's really important to eat before, at least 2 hours before bed, have it fully digested, or longer, like more than 2 hours, but at least 2 hours. And then that way our digestive tract or our digestion has been optimized, and then there's less food for the microbes inside of us. And that is a really important thing. Hi, Maureen. You have major balance issues. Any suggestions for helping that? That's just one of the symptoms of these infections. And as you treat the infection, so there's a couple of issues. So, yes, we can have inner ear infections from these infections. They can be present in the middle ear, but sometimes it's towards the brain stem that the microbes are in our spinal fluid, in our brain fluid, and also in our brain, causing inflammation to nerves in that area. And with balance, it seems to be more in the brain stem. And as we stop feeding the infections and then as we treat them, people get their balance back. That's the only way to get our balance back. We have to treat what's causing the inflammation to our nerves. Hi, Kevin. It's awesome to see you here. Awesome. I'm so glad. So he's experienced great recovery from doing the plan. He's a wellness champion. And Sandra, what is oxidative? So oxidative, it is like an antiseptic. It's nice because it does not interfere with the parasite drugs or the herbs. It's kind of separate, and it is like an antiseptic, like oxidative means like an oxygen type treatment. And so it complements the other treatments, and it hits the parasites at a different way, in a different way. And it's really, really been helpful. And that is how we have seen all of these incredibly large worms as we have been using enemas. And so it'll kill parasites on contact, but it's very gentle for us. And that's how we've seen all these worms coming out of the students. So you can see in some of my other videos that I've shared lots of worm pictures. And that is the only way that we have discovered this, because otherwise it's pretty hard. Even if you were taking a parasite drug and it's killing a worm, then the dead worm would be more wrapped in your stool and you're not going to see them as easily. But with the enemas, we're seeing the worms really easily. It's really awesome. Okay. So, Kevin, if your symptoms are stronger, it's because you have more work to do in treatment. The symptoms only come from the infection. So, that's where we have to make sure that we treat long enough. And that is the very, very important thing, is that usually, and as far as treatment cycles, we find that if somebody is pre-diagnosed, so they haven't got a diagnosis yet, or they were really let's say they were really high functioning, they're not really disabled yet, then they might only need 4 to 6 treatment cycles. And they're about a month long. So treating worms and protists, treating fungus, and then treating either Lyme or with the herbs on the break week, they'll use herbs. And it'll be more tailored to, like, did they have a lot more Lyme symptoms or fungus symptoms? So a cycle is approximately a month. But people that have had MS for a while, they will often, do up to 12 a year to a year and a half of treatment cycles. And in time, I'm hoping that that can go down shorter, but that really will depend on, some doctors, they might use higher doses, they might use IV, etc., as we get more and more practitioners that are on board. But what we're using are safe doses that are recommended for their use. But again, when you have a worm that produces 100,000 eggs in a day, and you have immature forms that are they're dormant in your body, they're hiding under biofilms, it does take a few cycles to get them out of your system. So when we're feeling better and better and we're having a lot of recovery, and if we quit treating and we get symptoms back, it just means that we haven't finished treating and we have to treat more. So it's not just the carbs. The low carb is really important. It makes the treatments work better, but it just means we have more work to do. Hi, Sharonda. Hi, Jacqueline. You're very welcome. I'm so happy that you found it helpful. All right. Hi, Victoria. Botox injections. So Botox injections, I'll just wrap this up here, but Botox injections, they will help to manage symptoms temporarily, but Botox is a neurotoxin, so it's like paralyzing your nerves. And that's not the answer, right? What we want to do is we want to support our nerves. We want to treat what is impacting our nerves. And that's the important thing to do, is treat what's impacting our nerves. So we can use certain things to manage the symptoms until we're treating, but we always have to look at benefit versus risk. That's really important. So let's see, I don't know what you're using the Botox injections for, but all I can share is that sometimes people will use certain things for bladder issues, and just the diet alone really, really helps the bladder within a week's time. And that is very safe. That is not going to be damaging your nerves. So I personally would not use Botox. I would definitely get to treating the cause as quickly as possible. Hi, Rob. You're wondering if you can go into more depth of the eating plan, as you know that's the biggest reason that you didn't join yet. So I'm not sure what you mean about that. Can you maybe elaborate? I'll just answer that quick question, but maybe you just aren't clear enough on it. So the Live Disease-Free diet is a really simple diet to follow. It is not complicated at all. It is very nutritious. It is very health promoting. There's videos on it, so I'm not going to go into great detail about it, but I'll just quickly talk about it. All these infections that are causing our symptoms, they are thriving on carbohydrates, sugars, starches, carbs, etc. So when we decrease the sugars and the carbs, then we notice those infections are less active. The inflammation goes down significantly, and then it makes it easier to treat the parasites. So I know for men, they love meat usually, and so we're able to eat animal protein. We're able to eat many different types of vegetables. We're having more healthy fat. And so, and for guys, let's say if somebody is not severely disabled, maybe they're still working fairly hard, maybe in construction, guys might have 4 meals a day. But it's really healthy, really tasty. You never feel like you're hungry. You're supposed to eat. And to maintain our weight, we just make sure we're getting enough calories. And so as we're decreasing the carbs, we are increasing the calories for the healthy fat. So we're having animal protein, so whether it's beef, steak, or chicken, fish, pork, it doesn't matter, eggs, etc. And we're having lots of low-carb vegetables. So there's lots. We have a shopping list. There's broccoli, cauliflower, Brussels sprouts, all the Chinese vegetables, beans, asparagus, lots. There's lots of leafy greens. So there's an abundant variety of vegetables. We're eating a plate full of food. We're having lots of healthy fat. And we calculate how much healthy fat we need to have based on the calories that we're burning. So if somebody is, immobile in a wheelchair, they're going to use less calories than somebody who still is able to work, let's say a construction job. And so we're making sure that we have enough calories per day, and that maintains our weight. So that is the key. And this is the first step in recovery. That is why we notice that when people are following that, they start to have a lot of symptom improvement, and it makes the treatments work a lot better. And your taste buds will change. You will love it. And I know it's hard to give up certain things, but the way that we're eating to get off sugar and to get off caffeine and all of that, it only takes about 7 to 10 days and you're over the hump. We're eating regularly. We're keeping our blood sugar steady level. So we get over the cravings pretty quickly. So hopefully that answered your question. You're very welcome, Victoria. There are several different types of parasite drugs, Carl, that are used for treating cancer. I know that one doctor that was working with us, with our students a lot, he's really busy with a clinic that they're treating cancer. They're using mebendazole. I know albendazole has also been really helpful for cancer, and possibly ivermectin. There are many parasite drugs, and that's why cancer is an infectious disease. We used to think it was mostly just fungus, but now we're starting to see that there are different other types of parasites that are linked with cancer also. Good point. Okay, there are a lot more questions here. I'm going to let you go a little longer than I wanted to keep you here. But For those of you that joined in on my masterclass training that I did just 3 weeks ago, I am hosting a coachathon this Saturday at 10 o'clock Pacific. And in that, I'm talking in great detail about the Academy. I'll be talking about all the steps we take. You'll be hearing about past students, present students, and all the steps, the cost, everything. You'll have a chance to really do a deep dive into our Live Disease Free Academy so that you can know if it is a right fit for you. And otherwise, if you're new to this, all this information I'm sharing, make sure to watch my masterclass training. There will be a link in with this video and also in the feed, and watch it and learn about these infections and all the steps we take to recover. And then you'll be invited, if you want more information, if you want to learn about the Academy, then you can learn about that also. But I know that there's quite a few people that have joined and would like to join the Academy. And so the Coachathon is really for us to kind of just talk, right? Just to get all your questions answered, make sure it's a good fit for you. Because people have questions about, how do we access the parasite drugs, and how do we find a doctor, and can I do this out in Europe, and et cetera, et cetera. And so those are all the questions that we're going to be talking about so that you feel really confident that this is going to be your plan to recover, which is so awesome. Otherwise, please, if you enjoy learning this, please subscribe to our YouTube channel, Live Disease Free, and like and share this video. And I will see you next week, and we're going to go much deeper into the parasite drugs. And if I can figure out a different platform, I will be directing you to a different platform. It might be Odyssey. It's just that talking about the parasite drugs might be a little too spicy for YouTube and for Facebook. Other than that, have a wonderful week, and we will talk to you soon. Take care and bye-bye for now.